Welcome to our Antenatal Education Class. The following short videos and slides will help answer some of the questions you may have about the changes that happen to your body in pregnancy, the labour stages and pain relief, and what happens once the baby is born. This information will assist you to make birth choices in your birth plan. This generally happens around 34 to 36 weeks. Please speak to your community midwife for further details.
Hello, I'm Julie Sykes, Community Midwife at Chesterfield Royal Hospital.
And I'm Jane Ragg. I'm also a midwife at Chesterfield Royal Hospital as well.
What we're going to talk about today is how the baby passes through the pelvis in labour and the options that you as mums have regarding pain relief and the choices that you can make while you're in hospital.
And I'm going to talk a little bit about what the actual functions of the pelvis and with the baby passing through the pelvis, how important that is really in how it can influence the outcomes of when the labour starts with that. So obviously this is the pelvis and it's quite a rigid structure, as you can see, but our pelvises are more flexible than this because they've got ligaments in between, and you've got your tailbone, your coccyx as it's better known, on there, and I'll come back to that in a little bit because that can make a huge difference. Before labour starts, when you come to antenatal clinic and we're doing the palpations, the baby is above this is called the symphysis pubis here, and that joins together the pelvis in the middle, and that's why a lot of ladies towards the end of the pregnancy get a lot of discomfort as well, because if you imagine you've got the baby, you've got the placenta, you've got the waters and everything, and all of that is pressing on that structure, making a difference there. So when you come to clinic, we write cephalic free, and that actually means that the baby's head is still above the bony structure of the pelvis there, and when we do the palpation through your tummy, you can actually still move the head. And then as towards the end of the pregnancy, what happens is the baby starts to actually go into the pelvis, and so you can see there, it's common sense that you can see that you can only feel a little bit of the baby's head. The function of a contraction is actually to open up the cervix, but also to help the baby, assist the baby through the pelvis. So when you get a contraction, that's exactly what's happening. So even though it seems like quite a short journey here, obviously you've got a sling of pelvic floor muscles underneath your pelvis. It's not just like an open cavity like it is here. So the baby's got to come through those pelvic floor muscles there, and that's why it's a longer journey than it seems when labour starts. So when you get a contraction, and during the first stage of labour, that's when you're going to have to do all the coping strategies that Julie's going to talk about in a minute, and that we're going to do with the game with that. But the contraction will make the baby, every baby starts off in a different position before labour, and what we want actually is that the baby's back will be at the front of your tummy, so you've got a nice rounded shape like that. It'll be tucked in like this. And then some babies start off that actually their back's more to the side, or some babies actually start off that their back's more to the back of your tummy. And if you hear the term like baby's back to back or posterior position, that's important not to panic when you hear that, because some babies may not be able to turn all the way round, but assistance can be given to do that. But most babies, even though it might take a little bit longer in your labour, actually they'll make that journey quite nicely round to the front. So if you hear a midwife say that it's back to back position, don't freak out about that really. But if we can just demonstrate that what we would want is that most babies have got their back to the front, that means that the baby's head is actually really nicely flexed onto the cervix, and it's giving a better chance of the cervix dilating there with that. And then the reason why we try to promote more of an upright position as well when labour starts is because if you can imagine, if you're laid flat on your back, which you do still see on the TV version sometimes, but if you've got a baby that's in a different position like we just talked about, then that's not giving that baby the best chance of coming through the pelvis. So if you can imagine, if you're laid flat on the back, you'll see that the coccyx is like tipping slightly inwards like that. So if you've got a baby that needs maximum room, you've already limited those diameters, haven't you? Whereas if you're more in an upright position, the coccyx can then tip backwards, and then you're giving baby the better chance of coming through the pelvis with that. So that's the reason why we're trying to talk more about being in a better position for labour starting.
Your uterus is a muscular sac that sits very nicely in your pelvis, and when normally it's the size of a small pear, but it has to grow. When it grows throughout your pregnancy, we measure you every time you have an antenatal appointment. It's a muscular sac that works, and it needs to be nourished to work, so bear that in mind as well when you are in labour, to keep well hydrated, eating and drinking regularly. It's a sac that's full of muscle, ligaments. It's got a very, very good supply. And during labour, this uterus will contract every 3 to 4 minutes and regularly. What we're going to look at now is the different choices of pain relief that are available at Chesterfield Royal Hospital and at most hospitals. We've also got some cards which I'd like you to look at, read out and place where you think are appropriate on which particular choice of pain relief is available.